Gives us a second or two here. Okay. Go back to our Zoom call. And then, all right, I'm going to go live on broadcasting here. Takes about 10 or 30 seconds. Once you hear me say good afternoon, that's when we know we're live on the broadcast.
Okay. So I can go grab my water.
There you go. All righty, good afternoon, everyone, and thank you for joining us today. My name is PJ Prunty. I'm the president and CEO of the Greater Danbury Chamber of Commerce, and we are excited to be hosting another session of our Chamber Chat series that we just rolled out about 2 weeks ago. I am honored to be joined by Tom Kelly. Tom is the president and owner of AFC Urgent Care here in Danbury. Tom, I think you guys have 3 facilities in Danbury.
We do, that's right. Yeah, Mill Plain Road, Main Street, and Newtown Road.
Excellent, fantastic. And we are also pleasure to be joined by Dr. Iftikhar Ali. Dr. Ali is the medical director at AFC Urgent Care. So, gentlemen, thank you both for taking time out of your busy days to join us here this afternoon. We have participants that are joining us live here on our webinar. I ask that if anyone has any questions, feel free to submit through the chat feature box that we have down there at the bottom. We will get to those in just a few moments. So with that, let's dive right into it, gentlemen. Let's talk about what seems to be is at the top of everyone's mind right now, which is testing. A lot of misinformation out there, as you two very well know. What is the difference between antibody testing and swab testing?
So, Dr. Ali, maybe I'll take a cut at kind of the high level, then you can bring us down into the more scientific clinical component of it. So, the swab testing is also known as a PCR test, and that is what detects the actual presence of the virus in patients. It's done through a nasopharyngeal swab, where you have to, it's not the most comfortable thing, but you have to get in there and you have to get a minimal amount or a specific amount of material onto the swab for it to deliver the result that you're looking for. The antibody test, also known as serology test, tells you if you've had the disease or if you've had COVID-19. The difficulty with some of the tests that are out there is particularly let's talk about antibody test. The difficulty with the antibody test is if you were exposed and never showed symptoms, but did contract the virus, your body wouldn't start developing antibodies until about 14 days after exposure or 10 days after onset of symptoms. And one of the issues that we're seeing is, some folks are just testing everybody for antibodies. And unless you fall within that window, it's going to be an inaccurate test. And that's one of the problems is right now is people are running around thinking, well, I haven't had the virus, where in many cases they may have. So that's one factor, is the timing of that antibody test. The next factor is the type of test you're using. You hear a lot about these rapid tests, a lot about these finger stick tests that you can do at home.
Right.
The problem with these tests, many of these tests, Dr. Ali and I have been screening these things for 6 weeks. People have been coming around peddling these finger stick tests and these rapid, rapid response tests where you can get a result in 15 minutes. But what we found is, as we started to really peel back the onion on the testing that's available, about between some of these tests have between a 30 and a 40% false positive. So that means 30 to 40 people out of 100 are told that they are positive for this virus, for the antibodies for this virus, but in reality, it's a false positive. They're not. That's a very dangerous situation with testing for antibodies. The other is specificity. We have found that many of these rapid tests or finger prick tests aren't specific to COVID-19. They are telling you if you have antibodies to a coronavirus. And there have been, I don't know, Dr. Ali, 4 or 5 of these in the past 20 years that have swept through the country, something like this. But so we work with a high complexity lab out of New York that's developed their own test for antibodies. They have the EUA from the FDA, which is emergency use authorization. But it is the gold standard of testing, right? It involves phlebotomy, a blood draw, which is then centrifuged and a substantial sample sent to the lab for testing. And there, it is specific to COVID-19 and has a very high degree of accuracy. So whether if people are looking for an antibody test, whether they come to AFC or they go somewhere else, just make sure you're getting the right test that is going to deliver an accurate, reliable result that is actionable. And I know, Dr. Ali, we still don't know if the presence of antibodies means that you are now immune to this virus, correct?
Yeah. Antibody positive, there are two types of antibody. The one that's available right now is called the IgG. So IgG historically for the other infection, it tells you that you has been exposed and now you're immune to it. But the problem right now is that COVID-19 is totally a new bug. So we don't know how long that immunity is going to last. So if your IgG is positive, that means you has been exposed to COVID-19 and has been recovered. Just doing only IgG is not enough. If you have a symptom or you need to still have a nasopharyngeal swab along with that. So if your nasopharyngeal swab, I have seen a significant number of people where the IgG is positive, but their PCR is still positive too. That means they are still going through the asymptomatic infections as we're speaking. So that can also spread the disease to the other people, particularly elderly, other people who are more prone to have a chronic medical problem, hypertension, diabetes. So regarding immunity, so we don't know. You have some extent of immunity, but will you get reinfected if you have an IgG? Data is not enough for supporting it right now. We haven't seen any reinfection as of now, but we don't know yet.
Yeah, we could probably spend next couple of hours talking about this one particular topic. What I've seen out there too is insurance coverage. Now, do these tests cover insurance, and what happens if there are individuals who do not have insurance coverage for this test?
Yeah, it's a great question because there's a lot of confusion around that too. Early on, you were seeing in the news that, everyone will be tested for free, but no one was telling that to the labs. So the labs are doing all this work and developing, staffing, and making all this stuff. And everyone's saying, okay, well, this is free, right? So what we know is that, for our services, there's no charge for anyone without insurance. We've enrolled in a government program where we will provide this at no charge to the uninsured patients. Our labs and labs in general are working on the same thing, and we're waiting to hear how that resolves. And hopefully we'll have word here this afternoon that they're all set and they're covered by the government. They're part of this. For those with insurance, there's no copay, and the visit is covered and test is covered by insurance. So by and large, the way that this is structured, and by the way, the uninsured program just came out this week. We just got documentation on this week, and we signed up for it and got enrolled so that we're good to go. So as a parallel path, our labs are doing this as well. So going forward, this should be, anyone without insurance should not be getting a bill for this. Last week, when we were doing this for uninsured folks, they would get a $50 bill from the lab for the cost of the test. But we'll see. It looks like this is going to be covered going forward, so that's good news.
Okay, let's talk about what AFC Urgent Care has been doing in terms of responding to COVID-19 when it comes to preparedness, PPE for staff, which obviously is incredibly important, as well as just the general safety of all your centers throughout the area.
Yeah, that's a great question, because as soon as we knew that this thing was coming, Dr. Ali and I sat down with our management team, and we put together protocols for our staff and for patient engagement. At every one of our facilities, we have a tent, commercial tent outside, where we encounter each patient that comes to the building. And if anyone has any symptoms, or we think has had the risk of exposure, or has an elevation in their temperature, we treat them outside of the building. They don't come into the building. That way, no one's touching doorknobs, no one's, door handles, no one's touching, anything, and no one's entering the building who is suspected of having any risk of COVID-19. We also have been, fortunate in that we've been able to secure enough PPE to outfit our staff safely and to maintain that high level of safety for both the staff and for our patients as we kind of tackle this thing. So the most important thing for us out of the gate was, let's greet people outside, and if they have any issues or any suspicion or any chance of that we think they have this, we'll treat them outside. The other thing that we've been doing is we've been working with communities, towns, nursing homes to come on site and test their folks there. We've recently, Dr. Ali and I were reviewing some data this morning. We recently tested a couple of hundred people in a community in Connecticut. It was like a senior community where everyone was asymptomatic. No one had any suspicion of exposure. And 10% of those that we tested were positive for COVID-19. 17% were positive for antibodies. And this is in an asymptomatic pool where no one thought they were exposed. So, 200 is in some research projects, that's statistically significant. But in many cases, it's employees that are the ones that were testing positive. 70% of the positives were employees, because they're the ones coming and going, right? So, so we're trying to work with our communities. Dr. Ali and I have, been on many calls with many municipalities, corporations, and other groups to put together testing protocols. And a lot of folks, like restaurants, we had a restaurant group come up to us and say, hey, listen, we don't even know where to start getting people back to work here. Yeah. What do we do? And so, we say, well, let us, think about your pool, think about the various, people that you're going to have coming back here, and let us put together a testing protocol and plan for you, which includes getting people safely back to work with low risk of bringing somebody in that has the disease. But it also has a maintenance program going forward, like take everyone's temperature every day at the start of their shift. And if they have an elevation or they have any symptoms, get them over for a test.
All right. Excellent. Thank you, Tom. Dr. Lee, anything you'd like to add to that?
No, I think Tom has explained very well what we are doing. Along with that, we're also doing a telecare too. So telecare is a brand for our AFC, which is a telemedicine. And if patient, what we're doing is patient can register online. And particularly with the testing, sometime it is, we don't want people to show up in a group of 40 or 50 and then standing outside and then get exposed from each other. So they have an option, go on our website and click on the telecare and then register yourself. And we will give you an appointment. You come on that appointment and we will test you pretty much safely. And again, as Tom mentioned, that we are not bringing any COVID patients inside. So we have a special questionnaire that will screen all the patient who has a potential COVID-19 active infection. So the IgG is going to test the previous infection you have been exposed or not, but still there are significant number of people. So I would say to one estimate is about 50 to 60% of people are going to be asymptomatic. They will not know that they have an active disease or not. Only the testing will tell them that they have it, and they can spread the disease to a lot of vulnerable peoples in the community.
incredible statistic about that. Just a reminder to those that are joining us, feel free to use the chat feature there if you have a question. Now's your chance to ask Dr. Ali and Tom Kelly anything relevant to their urgent center there. So, Tom, you mentioned a little bit about some of the conversations you've had with the restaurant in terms of back to work assistance. What guidelines would you offer to the greater neighborhood businesses and employers, as phase one is just a couple days ahead of us here on the 20th in regard to Connecticut's reopening? What sort of general guidelines and advice would you provide to the businesses?
So, I'll actually hand that to Dr. Ali. He has put together a very, sophisticated set of well thought out protocols and guidelines for various types of businesses to get back. Dr. Ali, you want to field that?
Sure, definitely. So thank you, Tom. So the guideline is going back to work. We have a comprehensive guideline. Basically, all the employee, we prefer to test them both for a nasopharyngeal swab, which will be the PCR, as well as the serum antibody testing, which is also called the serology testing for IgG. The combination of that, and then we have put together a comprehensive questionnaires. So that will tell us what is the history, and if you have any symptom. Before we test, we also take the full vitals, particularly the your blood oxygen level, which is called the O2 sat, as well as the pulse and temperature. And then based on those two tests and the history and the questionnaire, we can differentiate the employee into three groups. One group will be that they had a past disease, they have some level of immunity, and their chances for them to getting reinfection is a minimum, even though we don't know it, as compared to all the other similar kind of, based on the similar kind of infection in the past, such as measles, mumps, and rubella. Once you have the immunity, to some extent, you will be immune. And the second is the PCR. If any patient, any employee who has an asymptomatic disease, and if their PCR is positive, that means they have to stay home for another 10 days. And after 10 days, they can come back. We can test it. If PCR is negative, they are safe to go back to work. Of course, you're going to continue the precautions of covering your mouth and then washing your hands after every encounter and touching any places, which is a standard precaution protocols in place at this moment. The third group is going to be who has no antibody and the PCR is totally negative. That means that group of people have not exposed to COVID-19, and they need to take an extra cautions. And the employer that specific group of people need to ask the questions in the morning and then check their temperatures every day before the start of shift. So with this one, we can just point out who need a little bit more monitoring and who does not.
Excellent. Let's thank you for that, Dr. Lee. Appreciate that response. We'll stay on the opening right now, realizing no one, and not nor me nor you nor Tom have the ability to sort of forecast what's going to happen in these coming weeks. But
right.
What do you feel? Do you feel though there's this inevitable increase of infections once more people will be coming out of their homes and phasing back into their to what is going to be the new normal, is a buzzword we've been hearing. So my question is, to what extent do you anticipate an increase in infections, and how much time has to elapse before we see substantial enough data to really determine what would be proper course of action? And again, just a disclaimer, I'm not holding you to any kind of, fact here, realizing that this is all based on sort of your professional opinion.
Right. I mean, at this stage, it is hard to predict what can happen, as you said. I wish we could predict a really nice way. Okay, you go back to work and there will be a chances of only this person, that percentage, and then it is hard to really predict it. So I think our Governor Len Lamont has laid out a very comprehensive programs under the guidance of healthcare department, particularly an epidemiologist, to really predict it based on the factors what is out there and how the disease is acting right now. I think if we follow those guidelines, that plan, I think we will be okay. But again, even if I would say that there will be no increase in number of the new cases, if we maintain what number of cases every day right now, I think it's a good step to take it slowly but surely, and then depends on what other things will comes up after the opening on 20th. So it is have to be juggled day by juggle. It's hard to read.
Yeah, we were talking about this earlier, actually, and it's, you know, the fear is that everybody is cooped up and looking, dying for things to get back to normal. And, you know, so I was reading something where Google data is suggesting that the movement of people just based on their phones is like just exploded here in the past couple of weeks. And, but like, you know, Dr. Ali was saying, if we can maintain social distancing, wear your masks, and let's let, you know, just take those precautions, then, you know, you know, while your exposure is going to be higher while you're out there, your risk of contracting is going to be, you know, you're going to, you know, keep that lower. So, you know, distill it down to some basic behavioral practices, and, you know, hopefully people will do that.
Yeah. And let's talk about another component that's pretty integral in terms of the phased reopening and the contact tracing. What are your guys' thoughts on contact tracing, both for the public in general and employers as well?
Yeah, we've been having some discussion about that. That's a hot topic in the state now, and I think, you know, the first step in this is getting accurate data, testing data, back to the Department of Health as quickly as possible. We were talking with the Danbury Department of Health earlier this week about the issues that they're having getting quick results on testing, as most testing goes down back to the state level and then gets filtered out to this, you know, towns and cities. So, you know, it might be a week before, you know, somebody gets that information. And so what we've done is we've gone and tried to really streamline that process so that as soon as we know, that information is shared with the towns and the folks that we're dealing with. And it takes a lot of work and effort and people to make that happen, but that's what's got to happen to make contact tracing work. And, you know, it's all about timing of identifying those folks who are walking around with the virus, even if they don't know they have it.
Sure. Dr. Lee, anything to add to that?
I think Tom said it very well. So definitely how we streamline the data back to the local Department of Health is the key for the contact tracing, so that they can make a phone calls to the peoples and really pinpoint it, that whole mapping. I think what we have done is, as the overlap is, we're providing the result on the same day. The day we know it, Department of Local Public Health know it immediately.
Yeah, basic common sense there. So each guest that I have on here, I ask for a piece of advice that they could provide to businesses in the greater Danbury area. Obviously, both of you have had tremendous experience in your respective careers. Any piece of advice you can leave with the businesses to how to sort of navigate the new normal again that we've been hearing as a buzzword?
Yeah, so I'll start by saying that making sure that you're testing and where necessary, retesting your staff, you know, is the first step to making sure you don't have an implosion in a month or, you know, or two because of exposure. Temperature, first get them tested and get a good test, whether it's AFC or somewhere else. Don't get an at-home test or a drive-through, you know, swab at a pharmacy or a you know, one of these rapid tests. Get a gold standard test that is a blood draw for antibodies and a nasopharyngeal swab for the PCR to detect the virus. make sure you're holding a standard on that so it's accurate. The worst thing that can happen is you're trying to cut corners and you get a bunch of inaccurate information, and that causes an issue down the road. If you do it right up front, then you don't have to worry. You've done everything you can to ensure it going forward. And then retesting, we're seeing a lot of municipalities, first responders, they want to test their folks, and they want to test them periodically going forward as well to ensure that they remain virus free. So I guess that would be my 2 cents, and I guess that really comes from the protocols that Dr. Ali has established. So sorry, Doc, I just stole you.
That's okay. That's okay.
Excellent. All right. So thank you again, gentlemen. Really appreciate both of your time. Anything else you'd like to contribute to our conversation today? Feel free as we're wrapping up. So,
anything, Dr. Ali, that you'd add?
Yeah, I mean, as the Tom said, the testing is we have a lot of testing available. So the type of test is important. Basically our turnaround time for all antibody as well as the PCR testing is within 24 to 48 hours. So without the testing, there is predicted that a lot of the rapid and testing, they have inaccuracy, not only the false positive, they can also give you the false negative, that you do not have an active disease, particularly the PCR, all of the rapid PCR nasopharyngeal swab, they can tell you, oh, you don't have a disease. In reality, you have an active infection. You can, if you go back to work with an active infection, you can infect a lot of other people. And then again, social distancing, and then covering your, always put the mask on it. The mask is basically is not that you are going to protect somebody else. Basically, you are protecting yourself. When you really look at it, at least 5 or 6 times in an hour, you touch your nose, you touch your mouth unexpectedly, unwillingly, and that can actually give you the disease. If you touch any other surface and you touch your nose, mouth area, and then you are going to acquire the disease. Mask is basically protecting you from getting it.
Sure. Thank you.
One thing to add to that, PJ, if I can, Dr. Ali brings up a good point. This test, they've loosened some of the restrictions on these tests. We have our lab has been able to provide us with a lot of capacity now, and so we have capacity to test. We prefer that people register on our website. There's a button there for COVID testing. The only people that we are not going to test for antibodies are folks that do not fall into that category. Right. Or we'll tell them, if you've not been exposed and you have not had symptoms, there's a chance that you fall into this window, and the test may not be reflect the reality of where you are. Because if you were exposed 7 days ago and you have had and you're asymptomatic, it's too soon for your body to build antibodies. So at that point, it would be, we would suggest if you start to develop symptoms, come back. But we're not turning people away from being tested. They'll see our provider when they arrive on site. We will take them through a questionnaire, do their vitals, and get some prior medical history, and then we'll run the tests on folks. So there's a lot of capacity up there right now in Danbury, and for us to take care of and get these folks tested.
Excellent. Appreciate that. Actually, no, I just got a text question that came through here. Again, not sure if we know the answer to this, but what is the current prediction of the percentage of people that will be exposed to the virus? I'm not sure if there's a number out there that you are confident with or have heard through your circles.
Yeah, I mean, listen, there's so many data points. It's tough. If we look at the data that we just went through this morning, based on 200 tests, right? That's not a large pool, but it is something. 17% of them had tested positive for antibodies. Okay, 10% tested positive for the virus. So those are the 2 data points I can personally attest to.
Sure. Yeah.
But Governor Lamont is doing a nice job of communicating here and getting information out to us. I thought you had a great chat with him the other week, PJ. I've been really enjoying these chats that you're doing. So nice job on that. And then the CDC has some some information and projections there, but it's really tough for us to talk. I can't talk about anything except for what I'm personally seeing in our data. Would you add anything to that, Dr. Ali?
No, I think that's, you said very well. So based on what we have tested, that's what the number shows at this moment. So more people will be tested for antibodies and the PCR, the more we know the data and more we can predict what number are there. So the key is testing.
Yeah.
So I will tell you this: these were all asymptomatic patients that we tested, where that data came, 10% and 17%. I will tell you that in our facilities, we're seeing 27% positive PCR tests. So that's 27% of the folks that we test for the virus, the PCR test for the virus, are coming back positive. Keep in mind, this isn't just a sample of the community, a random sample.
Right.
This is a group that has been, deemed at risk or symptomatic. So they meet a criteria to be tested for the PCR historically. And we've tested thousands. So that is statistically significant data. Unfortunately, it's on a very narrow pool of people that were identified as risk.
Excellent. All right. Well, Dr. Lee, Tom, thank you very much for your time today, but also for all the time and energy you and the entire team at AFC Urgent Care are putting in there to protect our community. So we truly do appreciate that. So thank you very much. I also want to give a quick shout out to our communication director here at the Chamber, Amelia Anderson. She's been assisting with all the communications for the webinars and chamber chats and all the resources that we've been sending out. So Amelia, thanks for all your hard work. Next week on Monday, we actually are hosting Cynthia Emery Roy. She's the president and CEO of Regional Hospice here in Danbury. So we'll have a chance to chat with her and see how things are going.
Well, PJ, thanks so much, man. Yeah. And I just a shout out to the AFC team. These folks are amazing. They're running into the burning buildings, right, so to speak, and they are meeting this moment for the community. So shout out to the team and Dr. Ali for everything you've done, man. It's been a lot of hard work, long hours, but this is hopefully we're reaching a turning point. Yeah. Thank you, PJ.
Yeah, thank you everyone, and stay healthy and stay well. Take care.
Thank you.